Hello everyone, welcome back to CMME Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos, and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page, and the link will be given in the description. Earlier, we discussed different mortality indicators and disability rates. Today, we shall continue with the rest of the health indicators. The first one is the morbidity indicators. We know mortality tells us about the death. So, different mortality rates or indicators tells us about different death rates. But in a community, we will not always have death from a particular disease. We can also have number of cases who are suffering from the disease but not dying. So, different diseases or other health related events that can be described using different morbidity indicators. Some of them are like this. First one is the incidence and prevalence. We uploaded a video last year where we discussed incidence and prevalence in details. So what is incidence? The number of new cases appearing in a given community in a given period of time. And what is prevalence? Prevalence is the number of existing cases, which includes the number of new cases, that is the incidence cases, as well as some cases which were already existing before the time period and continued in the time period as well. So the existing cases, that is the new case plus old case. Then we can have notification rate. So how many cases of a particular disease is being notified. If the notification rate is higher, so that means there may be some outbreak of the particular disease. Attendance rates at the outpatient departments or OPDs and the health centers. So again, during monsoon or after the monsoon, if you are having a lot of diarrheal cases coming to the OPD, so you can say that there is a little bit uprise in the number of cases of diarrhea. Admission, readmission and discharge rates, duration of stay in hospital. So for a particular disease, how many days a patient needs to stay in the hospital, that is the duration of stay in the hospital. Spells of sickness or absence from work or school. So again, same thing. If a person is not going to work, or maybe a child is not going to school because of illness, spells of illness or sickness, that will also give us some idea about the morbidity situation for that particular disease in that particular community. The next one is the nutritional status indicators. There are a lot of indicators which tells us about the nutritional status of a particular person or a group of people in a community. For example, anthropometric measurements, which is basically the measurement of height, weight, etc. That can be done in adults, but more commonly done in under 5 children. So we can measure their weight and height and can plot in growth chart. We have weight for age growth chart, height for age growth chart, also weight for height growth chart. We can also measure their mid upper arm circumference, that is MUAC, which is usually measured in between 6 months and 5 years of age group, and that will also tells us about the nutritional status of the under 5 child. Alternatively, we can measure the height and sometimes the weight of the children at school entry. Prevalence of low birth weight, that is the birth weight less than 2.5 kg, can also give us some idea about the nutritional status of the mothers and especially the women of reproductive age group. Similarly, prevalence of iron deficiency anemia can also give us some idea about the nutritional status in terms of iron deficiency among the women of reproductive age group. So these are the different indicators that we have for nutritional status assessment. Then we have the healthcare delivery indicators. There are different indicators which tells us about the healthcare services that is available in the country. For example, doctor population ratio. So for a certain number of population or people in the population, a certain number of doctors should be there so as to provide an uninterrupted quality service. So maybe say for 1000 people there should be one doctor in a village, like this. Similarly, we can have doctor nurse ratio, population bed ratio, and population per health or sub center ratio, then population per trained birth attendant, etc. So as you can see, these are the indicators of the healthcare delivery system in terms of manpower. For example, how many doctors, how many nurses, and how many trained birth attendants should be there, and also in terms of the different infrastructure, for example the bed, sub-center, etc. Next is utilization rates. We may have different health services available, but whether these health services are being utilized or not, that is another question. So some of the indicators which tells us about whether these services are being utilized or not are like this. Proportion of infants who are fully immunized against the 9 EPI diseases. So all the diseases which can be prevented by vaccination, how many infants are fully immunized with those vaccines. So that is one of the utilization rate. Proportion of pregnant women who receive antenatal care or have their delivery supervised by a trained birth attendant. So out of all the deliveries, how many of them have been conducted or at least supervised by a trained birth attendant? That can be a doctor, a nurse, whatever. A percentage of population using the various methods of family planning. So we know that different family planning methods are available, and they are also available free of cost from the different government health centers. Now, how many people or what proportion of population are using these different methods of family planning? That is another indicator of utilization. Bed occupancy rate. So we have a particular number of beds in a given hospital. So whether these beds are often empty or they are occupied, that will tell us about the utilization of services in that hospital. Average length of stay, so for how many days these beds in the given hospital are being occupied, etc. Bed turnover ratio, etc. So all these are the different utilization rates for different health services that we have in our country. Social and mental health indicators are they are the indirect measures of different social and mental pathology, and they include the different rates of suicide, homicide or murder, different acts of violence and other crime, road traffic accidents, and juvenile delinquency, especially the alcohol and drug abuse in this age group, smoking, consumption of tranquilizers, and even obesity, because obesity is somewhat related to depression. So all these are the different social and mental health indicators of a country. Next is environmental indicator. These indicators relate to different pollution of air and water, radiation, solid waste, noise, exposure to toxic substance in food or drink. Some examples are given here. For example, the proportion of population having access to safe water and sanitation facility. So how many of them have drinking water source close to their home, or whether they have any access to waste disposal facility. So all these are different indicators of environmental sanitation. Next is socio-economic indicators. For example, rate of population increase, per capita GNP, level of unemployment, dependency ratio, literacy rate, especially female literacy rate, family size, housing, that is the number of persons per room, which will give us some idea about the overcrowding and overall economic status of the particular family, per capita calorie availability. These are different socioeconomic indicators, and these are very important because socioeconomic status is directly or indirectly related to different diseases, especially non-communicable diseases like hypertension, diabetes, and some of the communicable diseases, especially those respiratory illnesses that occurs due to overcrowding and all, and also different gastrointestinal infections like acute diarrhea, episode, etc., which is related to the environmental hygiene, which again is related to the socio-economic status of the particular community. And then we have the health policy indicators. What proportion of GNP, that is gross national product, is being spent on health services. This is important because whatever is the GNP, it is important that we spend a significant proportion of it on different health services, so that there will be adequate funding and different health services can be provided uninterruptedly. Also different health related activities are there, and what proportion of GNP are being spent on health related activities. For example, water supply and sanitation, housing, nutrition, community development. So these are not directly related to health services, but they are obviously health related activities, because a safe water supply, provision of sanitation, there is a provision of nutrition, and also community development will ultimately help to improve the health status of the community. Then we have the proportion of total health resources devoted to primary health care. So how many resources or how much resources are being allocated for the different services provided at primary health care or primary health center, that is also another important indicator for different health policies. Quality of life, very commonly used indicator is PQLI, that is physical quality of life index, and about couple of months back we already uploaded a detailed video on PQLI, so I'm not going to discuss in details, but just to remember, we considered three things here. Number one is the infant mortality rate, then life expectancy at age 1 year, and also the education, the level of education. All these three things are considered for PQLI. Last one is the social indicators. There are a lot of indicators which tells us about the social status. For example, United Nations Statistical Office has given 12 categories as social indicators. For example, population, family formation and families and households, learning and educational services, earning activities, distribution of income, consumption and accumulation, social security and welfare services, health services and nutrition, housing and its environment, public order and safety, time use, leisure and culture, social stratification and mobility. So all these are indicators of social status of the community. So these are the different health indicators, and with this we conclude today's session. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends. We also have our Facebook page that you can follow. The link is given in the description. Take care, and we shall see you in our next video.